All right, so this week, instead of doing an outcome measure of the week, I'm going to do a little bit of a reflective and kind of preemptive video on my physical therapy philosophy. So 9 weeks into the residency now, kind of really starting to feel a little bit more comfortable, not totally comfortable for sure, but definitely a little bit more comfortable in the clinic. And I wanted to make a video on my PT philosophy because I really feel like it's going to change over the next couple months as I really start to get even further into the residency. And I really want to kind of document it now and then kind of see where it is at the end of this acute rotation, at the end of the inpatient rotation, and at the end of the outpatient rotation, and at the end of the entire residency. So kind of when I graduated school, my entire concept and thought process on our role and our job as physical therapists, aside from the obvious, making patients better, feeling better, better movement, yada, 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 was that, our main goal is to really increase the self-efficacy of our patients in rehab, through rehab, to allow them to be better stewards and more independent stewards of their own care. That was my PT philosophy kind of before coming into the residency. At the end of our schooling, we had to kind of not present, but build a professional portfolio type of thing and put a professional statement in there. I'll put that on the screen just so you guys can see what that kind of looked like. So I have a reference for what that looks like too. And now I would say it's changed slightly. It's definitely still our role and our position is to improve their self-efficacy, to make them stewards and independent within their rehab, and to make themselves the best people and educated patients as we can to direct their care and make informed decisions about their care. But I also think more so now that our role as therapists, especially in the neuro setting, maybe more so than the ortho setting, is to position our patients and bias our patients through our interventions to have their brains work better for them in a physical movement and functional sense, but through the patients themselves. And that might not really make any sense, and I'm sorry if that doesn't make sense, but that's kind of how it comes out. So improving their self-efficacy and their autonomy and ability within the rehab process, but biasing it through our expertise and our interventions to position the brain in a place where it can best rehab itself and rehab the body, because at the end of the day, in my opinion, the brain can do more for the body than we can ever do as an outside practitioner. And that includes doctors, OTs, psychologists, PTs, everybody. Some people might disagree with that, but that's kind of how I feel rehab works and how our bodies work. And all we're doing is taking our expertise on the brain and the body system and movement to bias the brain to do that more efficiently and better. So I guess if I had to put it all into one statement, I'd say that our role as physical therapists is to position the brain through improving patients' self-efficacy and using targeted intervention strategies to improve the body's ability to heal itself with movement. I guess that would be kind of my action statement or my PT philosophy statement. And using principles of neuroplasticity and motor learning, optimal learning theory and all of that kind of plays into that. And I think right now, if I had to say one particular concept was the most important concept in rehab and neuro rehab right now, based on my understanding of neuro rehab and kind of how I feel and think, it would 100% be saliency. Make your interventions and what you're doing salient for the patient, because that will best bias their brain to reorganize, rethink, and help themselves through rehab. That is my soapbox. I'm going to step down from it now. That is kind of where I feel like my philosophy on PT is at this current moment. I'm excited to kind of track that as I go through the program. So kind of halfway through the first rotation, so I thought it'd be a good time to do it now. I'll do another one at the end of the acute rotation, and then slash the start of inpatient rehab, halfway through inpatient rehab, and then kind of so on through the rest of the residency. And I'll go, what I'm going to remember to do is go back and watch this video and kind of see how it changed, and then I can do a reflection video on kind of how I feel like it's changed in, the 9, 10, 11 weeks. I don't know how long each rotation is. So that's this week's outcome measure of the week video. My PT philosophy. Hopefully you enjoyed it, and I'd like to hear what your PT philosophy is. Feel free to comment below or reach out. I'm always excited and curious to see what other people think. So that's this week's video. Thanks for watching.